Why even one? Preventable deaths in global health. She didn't die because we lacked medical knowledge. She didn't die because we had no treatments. She died because of silence, because of distance, because of delay. In a world filled with solutions, why does even one person still die from a preventable cause? Why? Even. One. Hello and welcome to Global Health Lens. I'm Dr. Mesgebu, a public health doctor, researcher, and advocate for global health equity. And today I'm asking a question that many public health workers wrestle with. Why are millions still dying every year from causes we know how to prevent? And more importantly, what can we do about it? Let's start with the raw truth. 1.5 million lives are lost annually to vaccine-preventable diseases like measles, tetanus, and pneumonia. Over 800 women die each day, not from rare complications, but from routine childbirth without skilled care. 500,000 children die each year from diarrhea. Deaths that could be prevented with simple solutions like oral rehydration salts and clean water. These numbers are heartbreaking, but they're not new. We've had the answers for decades. These are preventable but still dying. For instance, in the early 2000s, a number of children, particularly in developing countries like Ethiopia, died of measles. Not because the vaccine didn't exist, but because their community lacked access to it. Across the world, a woman in rural Philippines gave birth at home. They bled to death while their family waited for a neighbor with a motorbike. These are not isolated tragedies. They're predictable outcomes of weak health systems, underfunded care, and global neglect. When health becomes a privilege of geography or class, we shouldn't call it a health system. We should call it what it is, a system of exclusion. Why it still happens. So why is this still happening in 2025? Inequality. Access is not distributed fairly. Rural, pastoralist, and marginalized communities are left behind. Underinvestment. Some governments and global agencies prioritize hospitals over basic community care. Lack of political will. Health policy too often waits for a crisis before responding. Yet the cost of prevention is far less than the cost of death. It takes less than $1 to vaccinate a child against measles. A clean birth kit costs less than a loaf of bread. Oral rehydration solution, less than the price of a bottle of soda. Solutions that work. The good news? We know what works. Mobile health and nutrition clinics, MHNCs, in regions like Afar, Somali, and Oromia of Ethiopia and other similar countries are reaching pastoralist families who once had zero access to care. Community health workers, often women trained locally, are delivering family planning, childhood immunizations, and malaria treatments door to door. Digital health platforms / telemedicine are helping connect remote patients to urban doctors in real time. Public health education, from radio shows to WhatsApp campaigns, empowers people with life-saving knowledge in their own languages. These aren't hypothetical solutions. They are real, scalable, proven. What's missing is global commitment and sustained investment. The cost of inaction. For every mother lost in childbirth, there are children left without care. For every child lost to diarrhea, there's a future we've erased. For every preventable death, there's a system that failed, and people who didn't act when they could have. We cannot accept that. Not now, not ever. Conclusion. Plus, call to action, so I ask you again. Why even one? Why even one death when we can prevent it? If this message resonates with you, share this video, subscribe to Global Health Lens, leave a comment. No more preventable deaths. Because one voice creates awareness. 1,000 voices create change. Together, we can turn these stories into solutions, and solutions into lives saved. Until next time, I'm Dr. Mezgaboo. Thank you for watching and for caring.